This is Representative Evan Goyke from the 18th Assembly District. Want to walk you through a policy that's going to be center stage in the state legislative debate in our response to the COVID-19 outbreak.
Earlier this week, Democrats in the Assembly and Senate sent a letter to Republican leaders urging them to immediately convene the legislature to address the COVID-19 emergency. I'm excited to break down one of the key provisions of the letter and policy arguments moving forward in the only way I know how, with some nerd power. This video is going to discuss important changes Wisconsin needs to make to our Medicaid program in order to maximize federal resources and save Wisconsin taxpayers hundreds of millions of dollars.
The federal government has passed a couple of pieces of federal legislation involving Medicaid. Medicaid is a national program, huge program in our healthcare system that each state administers. And so our Department of Health Services administers Medicaid. In Wisconsin, we call it Badger Care. About 17% of all Wisconsinites are enrolled in Medicaid. 1 out of 3 kids in Wisconsin receive health coverage through Medicaid. It's a huge, huge program, hundreds of millions of dollars at the state level, trillions of dollars nationally, and some important changes have been made to incentivize states and increase dollars into our Medicaid program for the increased costs in our healthcare system due to COVID-19. So here's how it works for Wisconsin. Currently, the federal government pays about 60% of the costs of healthcare for someone on Medicaid, and then the state pays about 40%. So that split means obviously the state pays in some, and it actually results in a pretty big number in our budget, but the federal government pays more. Under the new federal legislation that just passed, there's more money for our Medicaid system, and you can see here on my poorly written, bad penmanship whiteboard that under the new federal law, about 65% would be covered by the feds, which would reduce the state's responsibility to 35%. This seems like a small percentage, about 6% difference, but because it covers a huge number of people, this change would save state taxpayers an estimated $150 million for each quarter. Now, it's important this reimbursement rate, this increased rate, would only be present during the public health emergency, but if that extends into the summer or to the fall, we would have the potential to save $300, $400, $500 million. That would be state taxpayer dollars that we could put in other places like small businesses, people that are unemployed, covering people that have been displaced because of the COVID-19 outbreak. Now, here's the catch. The federal government set standards for states to receive this bump. And currently, our Medicaid coverage does not meet the standards of the federal legislation. So we need a state law change. We need the majority party in Madison to convene a legislative session immediately, and we need to make a number of changes to our Medicaid program, but we need to focus on these changes in state law to make us eligible for this increased funding. So we need to reduce premium payments. We need to reduce the emergency department $8 copay, and we need to eliminate the 48-month termination on Medicaid. Those provisions, and they were recently enacted under the previous governor, are contrary to the federal government standards for this increased match. So if we don't change state law, and if we don't do it quickly, we would not be eligible for this increased federal funding. We would not be eligible for what could be $50 million a month, and we wouldn't have those dollars to spend in other places that need relief now. This is a critically important step that the Wisconsin State Legislature needs to make as soon as possible. So if you're watching this and you contact your state representative or state senator, please encourage them to make the changes in state Medicaid policy in order for us to access this federal money. Thank you.